Welcome to another short from the VetMed Digest. Feline Hyperesthesia Syndrome, sometimes referred to as the rolling skin syndrome or atypical neurodermatitis, is a poorly understood disorder whose precise etiology remains unknown. The condition often presents dramatically, with affected cats exhibiting rippling or rolling skin along the lumbar spine, aggressive episodes of self-mutilation directed toward the tail or flanks, and excessive vocalization. In severe cases, this self-trauma can lead to tail mutilation. Due to the varied clinical signs, diagnosis of feline hyperesthesia syndrome is typically one of exclusion, demanding the systematic elimination of dermatological, orthopedic, and spinal diseases. Theories regarding the underlying cause are diverse. One perspective suggests it is a behavioral disorder, such as a compulsive behavior or displacement behavior triggered by emotional conflict or anxiety. Conversely, the classic sign of extreme sensitivity to light touch, known as allodynia, suggests the possibility of a neuropathic pain or sensory processing disorder. Interestingly, some cats demonstrate electrical activity via electroencephalogram consistent with focal epileptic seizures, suggesting that some episodes might be neurological in origin. New research even links the development of mild signs compatible with feline hyperesthesia syndrome to cats months after successful treatment for feline infectious peritonitis with the antiviral drug GS-441524, raising the hypothesis of a potential long-term adverse effect or long feline infectious peritonitis syndrome. Successful management requires a multimodal strategy integrating behavioral modification with targeted pharmacotherapy. Medications commonly used include selective serotonin reuptake inhibitors like fluoxetine and gabapentinoids, which target anxiety and neuropathic pain mechanisms. A retrospective study indicated that cats receiving behavioral modification alongside drugs often achieved cessation of medication after a year, whereas cats treated solely with medication usually required lifelong treatment. Another emerging, novel therapeutic route is fecal microbiota transplantation, which has demonstrated a high clinical response rate, approaching 87%, in affected cats, possibly by positively modulating the complex communication along the gut microbiota-brain axis. Despite the challenges in diagnosis, the majority of cats with feline hyperesthesia syndrome managed with targeted interventions achieve a favorable outcome, often showing complete resolution of clinical signs at 1-year follow-up. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.